So Kate, what do you love about teaching Food Matters?
Well, I love teaching with you, Jenny, and it's super fun to bring my perspective as a doctor alongside your perspective as a public health nutritionist and chef, and just to see what comes up in the discussions that we have with our students. Our graduate level students are from different professions. Our CME class is always from different professions, and the mix of perspectives is just really rich. So that's one thing I love about it. What about you?
Well, I love that too. And I also love teaching with you. And one of the reasons is because, well, first of all, I just think you're really, really good at explaining things in a way that is both like really factual and informative, but also really accessible. And it makes it really easy for me to complement that. Like we have a really natural back and forth that I think is really fun for me, but also the students appreciate it because we fill out the whole perspective. We bring different perspectives, but they're complementary.
Mm-hmm.
And I love that whole experience.
Mm-hmm.
And I also love just having the opportunity to dive into these subjects with
Mm-hmm.
students, because what I experience over and over and over again in the class is that they are so appreciative and so interested in learning more about the relationship between food and human health and food and environmental health. And they want to integrate it into their practice or their work.
Sure.
But just don't quite have enough information or ideas or tools to do that. And so I really feel like we're giving them something that they appreciate.
Mm-hmm. Mm-hmm. Yeah, great. That is well said. And I think from a healthcare practitioner and professional standpoint, likewise, the students that we've taught over the years really seem to grab onto this material and see how relevant it is to their practice or to their future practice if they're still in training. And that I think we have a unique ability to make it practical as well as actionable and not out of reach or not inaccessible.
Yeah, I agree. And the other thing that's really meaningful, and this happens every single time we teach, is that there's this community that gets created and this really sort of trusting, intimate, personal exchange that happens, I think, partly because of our relationship and the way that we teach, and partly because it's such meaningful content to people. And they really, when I like working with health professionals, future or current, because I know that they're doing this work because they really care. That's sort of a universal thing. And I appreciate that so much. And so there's this really personal component to the class that I just really enjoy over and over again. Everyone really connects on this intimate level.
Yes, and we all experience food. So it's pretty easy to connect to talking about food, experiencing food, and then eating food together, which when we do it online, it's a little less eating together, but nonetheless, it's the experience of sharing food and the experience of food in a community, which people have always done and really is a bonding part of life.
And honoring the meal. I mean, that's something that we talk about and we teach about, is giving the food and the eating the time that it deserves. And we get to do that in class and not minimize it and not just say it's, this unimportant part of the class, but it's a really important central part of the class. And I think the students really appreciate that.
Absolutely.